there isn't any logic that you can point to that once something like cannabis has been shown, or cannabis extracts from cannabis, pills derived from cannabis, have been shown to have a therapeutic effect, that they are not legalized under some kind of system, at least under a prescription system. There's nothing in the international treaties that stops Australia doing that. And for that matter, if you look at opium and opiate derivatives, Western medicine depends on opiates for pain relief and some other things as well, essentially. So cannabis is being treated very differently from how we even treat opiates at this point.
Would you like to see a similar environment here in Australia as there is in the US, with fairly easy access?
There is not exactly like the U.S. The problem with the U.S. environment is that it's a very odd situation. You have the federal government still saying this is illegal, and different states having voted from the ground up that it will be legal, essentially. And that's more or less still true for medical cannabis as well as for cannabis for recreation. And that's had peculiar results. First of all, the form of legalization in the country, in the states that have legalized it, is that the folk who are already running medical cannabis shops, because those were the states that first did that, have been sitting around the table in the discussion of how exactly are we going to legalize recreational cannabis. And it's essentially being quite entrepreneurially driven. The entrepreneurs at this point, though, are relatively small guys. They're not huge corporations. And that's because of the federal ban. The big corporations and the international corporations are worried about what would happen to them at the federal level. At the point where the feds decide, no, we're not going to have that policy anymore, which I don't think will be under Trump, but maybe the next president, they're going to move in fast. And the way the markets are being set up in places like Colorado and Washington State, it's another one of a pretty well free market, essentially. Great availability, essentially. Not particularly focused on how can we avoid the troubles. So I'm hoping that when Australia gets around to moving on these things, particularly with recreational cannabis, it'll move in a more cautious way and with more controls than are happening in Colorado and Washington State.
That's great. That's really good. I think we can, I was going to ask you about the global burden of disease, but I think you sort of covered that a bit earlier.
Well, look, I'll say a few words about the global. As far as I'm aware, what is being done in the global burden of disease is they're calculating the global burden of disease and which diseases it is. And then they're doing risk factors for factors which adversely affect health, and what proportion of the bad health or the bad disability is accounted for by this risk factor. And if you look at that list, then they've got tobacco number 2 and I think alcohol number 5 or something like that, and all illicit drugs together at 20 or something like that. That's not only about the inherent risk; it's also about how many people are using them. The illicit drugs are so low. And then for alcohol, for some reason, they decided they would put this little bit in that is the protective effect of alcohol. Now, if you look at the harmful effects of alcohol versus the protective effect, I've forgotten what the ratio is, but it's certainly higher than 20 to 1, the harmful. So it's actually a good teaching point to put it in there and say, look, yes, there are protective effects, but they're very small, and comparatively. As far as I know, there's no one who, the regular global burden of disease doesn't look at how much of the disease is prevented by this therapy or that therapy. That's not been its focus at all. So I don't think cannabis's protective effects are very likely to make their way in, because there isn't much there of the protective effect.
Good. I think everything has been covered actually. I think the other question I was going to ask you is when do you think it's going to be considered a medicine? When do you think public opinion will shift to focus it on being a medicine?
Well, it is moving in that direction now. I'm not sure if you can go, you know, it's around 2-year-olds having fits, essentially. I mean, very limited indications. But they're clearly committed, in Victoria at least, to going in that direction. And they've given licenses to folk to grow the cannabis for it. And so the system is on its way, but it's extremely restrictive. And you have all of these folk who are entrepreneurs rubbing their hands about this is going to be a huge market, and I can't see how that is going to be true. You know, I don't know what they're thinking, that whether they think they're going to sell it all in Indonesia or what it is that they're thinking. At the moment, the system is set up so it will be, it is now either available or will very shortly be available to a very small number of people, and then you can expect it to expand a little, but not very fast, essentially, as long as it's on the present trajectory, essentially.
Do you think it should be this restrictive?
I think what often, the whole issue is, what do you do about off-label use? This is, I'm not sure how much Australians use that term.
No,
but
not
Doctors usually can prescribe just about any drug they want, although it's very restrictive around the ones that are like cannabis, that are on the list of prohibited substances otherwise. And there are the things which are on its label, which is what it's recognized for as with controlled trials and whatever. And then there are other conditions which it might help with, but there's no controlled trials and so forth. And regular medical practice is that you will, the doctor will scratch their head and this isn't working. Well, why don't we try this other? Maybe it'll work, And that isn't what you read about in the textbooks, but that's how medicine actually works a lot of the time. And it seems to me that cannabis has enough of a potential therapeutic use in calming people down, in dealing with pain and so forth, that if I were a doctor, which I'm not, and was dealing with someone like that and other things didn't seem to be helping, we could try this. So that issue of how much, once it's out there as a therapeutic good, how restricted the doctors feel about how much they can prescribe it for things that aren't specifically what it was supposed to be for, is going to become an issue.
That's a really good point.
That's great.
Yeah.
We'll end with that.
Yeah.
Thank you so much.
Where's this going?